Welcome back to Have More Babies, the show where we tackle the big decisions you face as parents.
And today we're diving into one of the first and maybe most important ones.
Absolutely, finding the right pediatrician. If you're expecting or maybe you've just welcomed your baby, this search, well, it can feel huge, especially when you're sleep deprived.
It really is a high-stakes decision, isn't it? You're essentially choosing a partner for your child's health for potentially the next 18 years.
Yeah, not just a doctor, a partner.
Exactly. So our goal today is simple. Help you turn what feels like an overwhelming choice into a really informed decision. Make sure you find someone competent, trustworthy, an ally.
Okay, let's do it. Where do we even start? There are so many options out there.
Well, the foundational first step, is often about trust, building
Yeah.
that initial list.
Right. Start simple,
Mhm.
start reliable.
Mm.
Referrals. Maybe put down the internet search for just a second.
Talk to people you trust.
Your inner circle, friends, family, coworkers, especially those whose parenting approach you kind of connect with.
And crucially, talk to your existing doctors, your obstetrician, maybe your family physician.
Why them specifically?
Because they're in the local healthcare system, they often have candid insights, the kind of qualitative stuff about different practices that you just won't find online.
Okay, so word of mouth is the starting line. Get that initial list.
Yes. But then comes the really interesting part where we need to move beyond just anecdotes.
This is the vetting stage, right?
Yeah.
Checking them out properly.
Exactly. We have to dig into their credentials, experience, educational background.
Mhm.
This part is absolutely non-negotiable.
I think most new parents know they should check qualifications. But what does that actually mean? What are we looking for? Is just having an MD enough?
That's a great question, and no, it's really not enough. That's a crucial distinction.
Okay.
We need to look at their medical school, sure, but even more important is the specialized pediatric training.
Like internships and residencies.
Yes, their apprenticeship, their residency training, which focuses only on children, and of course how many years they've actually been practicing pediatrics.
So experience matters.
It does, but the definitive gold standard, the thing you really want to look for,
What's that?
verification of certification from the American Board of Pediatrics, the ABP.
Okay, ABP certified. Why does that specific certification matter so much more than just a standard medical license?
Because it signifies a much deeper level of dedication and, importantly, ongoing excellence.
Ongoing.
Yes. An ABP certification means the pediatrician didn't just pass one big exam years ago. They've gone through a rigorous process, and crucially, they are committed to ongoing professional development.
Oh, so they have to keep learning, keep updating your skills.
Exactly. It signals they meet the highest standards and are staying current with the absolute latest in pediatric medicine, science, treatments, care protocols. A general medical license just doesn't give you that same guarantee of specialized, up-to-date knowledge.
That really clarifies the value. Okay, so let's say we found someone who ticks those boxes, they're qualified, they're ABP certified. Now we shift to the practical side, the logistics.
Right, the day-to-day reality, the stuff that can cause real anxiety if it's not sorted out.
Like what happens when my kid spikes a fever at 2 a.m. on a Saturday?
That's the reality check, isn't it?
Oh.
Illness doesn't stick to business hours, so you absolutely need to verify their after-hours and weekend availability for genuine emergencies.
And maybe how they handle less urgent things too, like if I should have a question.
Yes, even more subtle, but so important. Ask about their policy for handling urgent or even just worrying parental calls or messages during the day or after hours.
Will I actually speak to a doctor? Or is it an answering service?
Exactly. Will you get a call back from a physician? Or will it be routed to a nurse line first? Knowing that process beforehand can dramatically reduce your stress level when something actually happens.
Makes sense. And location matters too, right? It seems small, but
Oh, it's not small at all, especially when you're juggling work, maybe other kids, and a sick child. Finding a clinic location that's close to your home or maybe your workplace is essential.
that 15-minute drive can feel like an hour when you've got an unhappy toddler in the back seat.
It really can. Think of convenience as like preventative mental health care for the parent.
Good point. And beyond just the map location, what about the actual office? Should you visit beforehand?
Absolutely. You must visit the office environment before you commit. Don't just rely on photos online.
What should you look for when you're there?
Pay attention to the vibe. The staff's demeanor. Are they welcoming? Stressed? How clean is it? Is it organized? Are the toys in the waiting room clean? Does it feel chaotic or reasonably calm?
The source material mentioned one specific, really critical detail about the office environment,
Oh, what was that?
the importance of a separate sick waiting area.
Yes. That is such a key indicator of a high-quality practice that's really committed to patient safety.
Why is it so crucial?
Well, think about your most vulnerable patients' newborns coming in for their first well checks. They have practically no immune system yet.
Right, you don't want them sitting next to someone coughing.
Exactly. If they're sharing the waiting room with a 7-year-old who has, say, the flu, that's a huge unnecessary risk. A well-run practice invests in having separate areas or protocols to keep well visits and sick visits apart. It minimizes the spread of infectious diseases.
That makes perfect sense. Okay, so credentials checked, practicalities sorted, office looks good. Now we get into the fuzzier stuff.
The personal domain. Finding the right philosophical match. This is really where that long-term partnership idea comes into play. It's where it's either forged or, frankly, broken.
So how do you figure that out? How do you make sure the doctor's approach actually aligns with your family's values? Because people have strong feelings about parenting choices.
They do, and your doctor needs to respect those. It really starts with observing their communication style during that initial consultation, maybe even during the office tour.
What should you watch for?
Are they really listening to you? Or are they just waiting to talk? Do they interrupt constantly? Do they seem to dismiss your concerns, even the small ones, out of hand? You need to feel heard.
And what if you have maybe less conventional views on certain topics, like vaccinations or maybe leaning towards fewer medications? How do you navigate that?
That's where you have to be direct. You need to inquire about their general philosophy of care.
Like asking them straight up.
Yes. Ask if they tend towards a more, say, holistic approach, focusing on nutrition, environment, or if their first instinct is usually a medical intervention. And this is exactly the time for that frank discussion about vaccinations or other preventive measures you might feel strongly about.
So the goal isn't necessarily to find someone who agrees with you 100% on everything.
Not necessarily. The goal is respectful communication.
Yeah.
You need to ensure they're willing to talk transparently, to cooperate with you, to develop a personalized care strategy that respects your family's comfort level and values. If your core philosophies just fundamentally clash, well, that's going to cause a lot of stress down the road.
Yeah, that constant friction would be exhausting. It's about finding someone you can collaborate with respectfully.
Precisely. And let's not forget the most important person in this equation.
The child.
The child themselves. Making the match personal means thinking about your child's unique personality and their specific health needs.
So like, if you have a really shy kid.
Right. If you have a shy or anxious child, you probably need a doctor with a really gentle, patient approach. Someone who won't make clinic visits even more stressful for them.
And what if the child has existing health issues?
Even more critical, if your child has a specific condition, maybe asthma, severe allergies, developmental delays, any kind of special need, you must find a doctor who has experience managing similar cases.
So you're not sort of teaching the doctor on the fly about your child's condition.
Exactly. That specialized experience ensures they're already equipped to provide the best care for your child's specific situation.
Okay, so when you're putting all this together, the credentials, the office visit, the philosophical chats, the child's needs, it sounds like it's a mix of like hard facts and just feeling.
It really is. It's combining instinct and data. Many seasoned parents will tell you that trusting your gut feeling is actually one of the most important factors.
You just have to feel comfortable, right, leaving your child in their care.
You do. But at the same time, you back that up with the data. Check those online reviews and ratings. Places like HealthGrades, ZocDoc, Yelp can be useful.
But online reviews,
Yeah.
they can be tricky, can't they? You often just get the really happy people or the really angry people. How do you sort through that?
That's a very sharp point. Online reviews need context. You look for patterns, not just single dramatic stories.
So if one person had a bad experience, maybe take it with a grain of salt.
Right. But if you see dozens of reviews all mentioning, say, consistently long wait times or difficulty getting urgent appointments, well, that's a data point you should probably pay attention to.
Use them as a supplement, not the main course.
Exactly. Use reviews as just one layer of information. Remember, things like that ABP certification, your own impression from the office visit, the communication style, those carry much more weight than anonymous online comments.
Okay, that makes sense. Let's shift gears slightly.
Yeah.
Thinking about the value a dedicated pediatrician brings, what's fascinating is how specialized they are compared to maybe a general family doctor who sees all ages.
Yes, that specialization is key. A pediatrician has specific education and training focused solely on childhood development, from newborns through adolescence and all the unique diseases and conditions that affect kids.
And sometimes they have even more specialized training.
They can. This is where subspecialty credentials might come in. If your child has complex or chronic health issues, you might need a practice that is either affiliated with or has within it pediatric subspecialists, like a pediatric cardiologist or an endocrinologist or a pulmonologist.
Which brings us to the actual services the practice offers.
Mhm.
Because not all clinics offer the same things, right?
Yeah. Definitely not. The range of services can vary quite a bit. So it's important to ask about what's available, especially services that might be particularly relevant to your family.
What are some examples of those sort of extra services that a really comprehensive practice might offer?
Well, beyond just sick visits and well checks, comprehensive practices often bundle in extra support, which is a huge plus for busy parents.
Like what?
Things like in-house lactation assistance for new moms, which can be a lifesaver. Nutritional counseling, maybe more in-depth behavioral or developmental checkups that go beyond the standard screening. Even things like sports physicals for old kids as they grow.
And I think the source mentioned some minor procedures, too. Things done right in the office.
Yes, that's another convenience factor. Depending on the practice, some pediatricians might offer minor procedures like medical ear piercings done safely by a doctor, or even newborn circumcisions, sometimes after the baby's discharge from the hospital.
Having that done by your trusted pediatrician instead of finding another specialist, yeah, that sounds much simpler.
It absolutely simplifies things. It keeps care consolidated with the team that knows your child best.
Okay, nearly there.
Yeah.
Before we talk long-term benefits, we have to cover the boring but essential stuff.
Yes. The practice policies. Never skip this part.
Money and insurance.
Exactly. Don't overlook the financial side. You need to inquire clearly about their billing procedures, what copays you can expect, and most importantly, which insurance plans they accept.
Gotta check that list.
You really do. Make sure they take your specific plan. Common ones like Aetna, Blue Cross Blue Shield Georgia, Cigna, Humana, TRICARE, or maybe state programs like Peach Care for Kids. Check your specific network.
Because finding the perfect doctor and then realizing they're out of network, that would be heartbreaking.
It's the worst. So always confirm insurance compatibility up front.
Okay, so let's imagine we've done all this. We've navigated the referrals, checked the credentials, visited the office, had the philosophy chat, confirmed the services and insurance. We found our match. What does all this careful work actually mean for our child's health in the long run? What's the big payoff?
The biggest, most profound long-term benefit is something called continuity of care.
Continuity of care. Define that for us.
It's basically the provision of comprehensive, uninterrupted medical care delivered by the same healthcare provider or practice, ideally stretching from when your child is a newborn all the way through their teenage years and into early adulthood.
That ongoing relationship, it sounds really valuable.
Yeah.
But what are the concrete benefits? Why put in all this effort up front to find the right long-term fit?
Well, the trust built over years is huge, obviously, but medically speaking, that continuity allows your pediatrician to become a true expert on your specific child.
They really get to know them.
They really do. They track their health history, their growth patterns, their developmental milestones over time. They notice subtle changes or trends, maybe in lab results, maybe in behavior that could indicate an underlying issue much earlier than someone seeing the child for the first time.
And catching things early usually means better outcomes, right?
Precisely. Early detection often leads to simpler interventions and much better long-term health. Plus, continuity strongly supports preventative care.
How so?
When a doctor knows your family history, your lifestyle, your child's unique baseline health, they can tailor preventive advice and screenings much more effectively. Think vaccinations, nutrition, safety advice.
So it's proactive, not just reactive.
Exactly. And this proactive approach doesn't just lead to better health. It often reduces future healthcare costs by preventing bigger problems down the line. Fewer emergency visits, potentially fewer hospital admissions. It pays off medically and financially.
That long-term relationship must also be key for navigating things like vaccinations, too. That schedule can feel complicated.
Absolutely essential. A good pediatrician, one you trust, guides you through the recommended vaccine schedule. They administer those critical vaccines, safely ensuring the right timing, the right dosage. They monitor carefully for any side effects.
And they help you stay on track.
Yes. For busy parents, a reliable practice provides those crucial reminders for upcoming shots and well-child visits, making sure those protective milestones don't get missed in the chaos of daily life.
This has been incredibly helpful. It really lays out a clear path for turning what feels like a daunting task into a manageable, informed decision.
That's the goal.
So to kind of wrap it up, the main takeaway here seems to be that the best pediatrician isn't some objective title. It's the one who is truly right for your child and your family.
That's it, exactly.
The one whose approach aligns with your parenting philosophy, who can meet your child's specific health needs, and maybe most importantly, who makes you feel fundamentally comfortable and heard.
You're not just picking a doctor, you're choosing a partner, an executive partner, really, for your child's health journey. This partnership provides that specialized knowledge and, crucially, that continuity of care from infancy right through to early adulthood. It builds that essential foundation for optimal health.
Fantastic.
Yeah.
Now, if you listening are looking for more helpful tips like these,
Yeah.
maybe detailed lists of services like the lactation assistance or behavioral checkups we mentioned, or just more information on what a really comprehensive pediatric practice looks like and offers,
Where should they go?
we highly recommend you visit omegapediatrics.com. They have a wealth of information related to everything we've discussed today. Again, that's omegapediatrics.com.
Definitely check that out. And if you found this discussion useful today, if you're feeling a bit more confident about taking this important step,
Please help us out.
yes, please take just a moment to like this video, subscribe to our channel for more conversations like this, and maybe share this video with another parent you know who might be in the middle of this exact decision right now.
It could really help them out. Thanks so much for joining us today for this deep dive.
It was a pleasure. Goodbye.